Hi, I'm Dr. Mia Harper. Before you grab vitamin D3 or magnesium, here's what older adults need to know.
These can help, but after 60, the wrong dose may strain kidneys or affect your heart. That's why this matters. Stay with me. By the end, you'll know when D3 and magnesium help and when they can backfire.
Picture this. You walk into a pharmacy, glance at the shelves, and see those shiny bottles of vitamin D3 and magnesium. Instantly you think, everyone says this is good for my health, I should probably take it too. But the truth is that for older adults, starting these supplements without guidance can bring more risks than benefits. In this video, I will explain exactly why you should be cautious before using vitamin D3 and magnesium, what science actually shows, and the safest, smartest way to handle these popular supplements. As we age, it is natural to worry more about bone health, muscle weakness, and fatigue. Many doctors talk about vitamin D for bones and immunity, and magnesium for sleep, nerves, and muscles. Pharmaceutical marketing amplifies this message, making it seem like everyone over 50 should be taking these pills daily. The problem is that health is not one size fits all. Every body reacts differently. Every person takes different medications, and supplements can either help or harm depending on the context. Vitamin D3, for example, is essential. It helps the body absorb calcium, strengthens bones, and supports the immune system. In older adults, deficiency can increase the risk of osteoporosis, falls, and infections. What few people realize is that when used incorrectly, it can be dangerous. Because it is fat-soluble, it accumulates in the body. Unlike water-soluble vitamins that are eliminated through urine, vitamin D can build up to toxic levels. Symptoms range from nausea and constipation to kidney stones, irregular heartbeats, and even kidney failure. Some studies have even shown that high doses of vitamin D in older adults, contrary to expectations, may increase the risk of falls and fractures. In 2019, a meta-analysis published in JAMA showed that high doses of vitamin D did not improve bone health, and in some cases worsened outcomes. Magnesium, on the other hand, is an essential mineral. It participates in more than 300 enzymatic reactions in the body, helping with nerve, muscle, and heart function. It is also linked to mood and sleep regulation. But excessive supplementation can cause diarrhea, nausea, and abdominal cramps. In older adults, especially those with reduced kidney function, magnesium can build up and cause low blood pressure, slowed breathing, and irregular heart rhythms. Moreover, magnesium can interact with common medications in this age group, such as diuretics, antibiotics, and heart rhythm drugs. A 2018 review published in Nutrients reinforced that while mild magnesium deficiency is common in older adults, supplementation without medical supervision can lead to serious complications, such as hypermagnesemia. There's also the problem of overlap. Many people buy a multivitamin that already contains vitamin D and magnesium. Then they add an extra vitamin D capsule because they read about it online. And at night, they take a magnesium supplement to help them sleep. Without realizing it, they are ingesting double or even triple the recommended dose. This cumulative effect is dangerous because it quietly pushes blood levels into the risk zone. And since older adults metabolize supplements differently, the danger escalates quickly. A real-life example helps illustrate. Margaret, age 68, began taking 2,000 IU of vitamin D per day and magnesium for leg cramps. A few months later, she started experiencing constipation, palpitations, and extreme fatigue. Her doctor discovered that her calcium levels were dangerously high, a result of excess vitamin D, and her magnesium had also accumulated due to weakened kidney function. She wasn't sick in the traditional sense, but the supplements themselves were disrupting her body. Stories like this are more common than most people think. So what should an older adult do? The first step is to get tested before starting any supplementation. A simple blood test can show vitamin D levels, 25-hydroxyvitamin D, magnesium, and kidney function. The second step is to prioritize nutrients from food whenever possible. Vitamin D can be found in fatty fish such as salmon and sardines, in egg yolks, and in fortified dairy products. Magnesium is present in leafy greens, nuts, seeds, legumes, and whole grains. Diet is much less likely to cause excess and also provides other nutrients that work synergistically. It is also important to know the safe ranges. For vitamin D, most guidelines recommend between 600 and 800 IU per day for older adults unless a deficiency is confirmed by tests. For magnesium, the recommended daily intake is 320 milligrams for women and 420 milligrams for men over 50. Supplements should not exceed 350 milligrams per day without medical supervision. In addition, it is crucial to be aware of interactions with medications. Vitamin D can interfere with steroids, some cholesterol drugs, and weight loss medications. Magnesium can interfere with the absorption of certain antibiotics, thyroid drugs, and diuretics. And supplementation is not set it and forget it. It needs to be reassessed regularly. What works today may not be safe 6 months from now. Health is dynamic, especially in later life. Many wonder why so many people overuse supplements. The answer lies in convenience. It's easy to take a pill and believe it will solve everything. But the truth is that daily habits, diet, sunlight, sleep, movement, and stress management are the real pillars of health. Supplements can be allies, but never substitutes. This does not mean that vitamin D3 and magnesium are villains. On the contrary, they are essential nutrients, and for many older adults, supplementation can be life-changing. The point is that context makes all the difference. With proper testing, medical guidance, and tailored doses, they help protect bones, muscles, and vitality. Without those safeguards, they may do the exact opposite. So if you're over 50 and considering vitamin D3 or magnesium, pause for a moment. Consult your doctor, check your blood work, and make sure you are making the right choice. Don't be swayed by labels or generic internet recommendations. Your health is worth much more than that. Growing older doesn't mean giving up on well-being. It means becoming wiser and more selective with decisions. Supplements can be great allies, but only when used wisely. The smartest step is to seek quality information, adapt choices to your body, and always remember that health is not about shortcuts. It is about consistency. This video is for educational purposes and does not replace medical guidance. Before starting or changing any supplementation, consult a healthcare professional.
Did you enjoy the video? Subscribe to our channel, Health and Wellness for All, for more tips and information. See you soon.